Hi, I'm Jess from Wisbech Primary Care Network. Today I'd like to talk to you about cervical screening, or how it's most commonly known as smear tests. All of the services we're going to look at today are available across all locations in and around Wisbech. This video is aimed to offer you some information as to why we offer cervical screening and what to expect at your appointment. Anyone with a cervix aged between 25 and 64 who is registered at a GP practice will be invited to have cervical screening. You can choose to opt out of this process at any time. When you're aged between 25 and 50, you'll be invited to attend every 3 years, and from 50 to 64, this will change to every 5 years. Cervical screening is done at your GP surgery by a practice nurse. The nurse will often be female, and at the time of booking, you can ask if your nurse will be male or female. You may also request to bring a chaperone. The test itself usually takes a few minutes, but you can expect to be in the appointment for around 15 to 20 minutes. This is as you'll be asked to confirm your details, and we will discuss why we've invited you to be screened, as well as offering you time to talk about any worries or concerns you may have. Cervical screening is not a test for cancer. We're looking for traces of HPV, the human papilloma virus, and if this virus is detected, your sample will then be screened for any abnormal cells that, if left untreated, may turn into cancer. You can visit the NHS website to find out more on HPV and how this is treated. Once you feel comfortable and consent to be screened, you'll be directed behind the curtain and given a sheet to cover yourself. The nurse will then ask you to undress from the waist down, and if wearing trousers, remove them along with any underwear. Once you're undressed, lay on the couch and use the sheet provided to cover yourself. The nurse will then ask permission to come behind the curtain and will be wearing an apron and gloves. Don't be alarmed if she has on a mask. This has become common practice since the COVID-19 pandemic. You'll then be asked to bend your knees, taking your heels to your bottom to allow your legs to part. The procedure involves the speculum being inserted inside the vagina and open to expose the cervix. The aim is to see the cervix and insert the brush into the cervix opening and rotate 5 times. This is where the nurse will then apply a small amount of lubricant to the speculum and insert this into the entrance of the vagina. Once complete, you can dress and your sample will be sent to the lab and your results will be posted to you. If the result is clear, you'll be asked to attend in 3 years' time. If HPV is detected with no abnormal cell changes, you'll be asked to attend in 1 year to retest. If there is HPV and cell changes are detected, you will receive an invitation to attend your local hospital for further assessment and review. Thank you for watching this video. Should you have any concerns about cervical screening, please visit the website below or contact your local practice.